And at this time, I'm going to call the meeting to order. As far as I can tell right now, we have the following grant committee members in attendance virtually. We have Dr. Jimmy Thompson, Sharon Buckman, Tim Spencer, Jim Holland, Mike Tillum, and Delegate Sewell. So we do have a quorum present to conduct business. So we'll go ahead and proceed. I also want to welcome the many guests that we have and also our wonderful staff that are with us. So thank you for being here. And just a reminder, we will have an opportunity for public presentation later in the agenda for any of our guests. So the first item on our agenda is approval of minutes from our meeting that was held on February 23rd. Those minutes were posted on our OAA website, as have all of our minutes been posted. So I would like an emotion to approve those minutes, please.
So moved.
Thank you very much. Tim,
Second.
Do I have a second?
Second, Jim Holland. Second, Jim Holland.
Thank you very much. I have a first and a second. All of our members in favor of approval of the minutes, please say aye.
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 Aye. Anyone opposed, nay? Okay, the approval is unanimous. Thank you for that approval of the minutes. We will move into our next item on our agenda, which is an update from our Executive Director, Tony McDowell. Tony, I'm going to turn it over to you.
Thank you, Dr. Thompson, and thank you, members of the committee and people who are joining us online. Just a quick item of administration. For the folks that are attendees, you're not able to speak unless you use the raise hand feature. You would do this during the public comments part, and we'll call on you to make your comments. But in the meantime, you can type into the Q&A, not chat, but there's a Q&A tab through Zoom. And if you'd like to type questions, we can try to address those as we're going through the meeting. And again, if you'd like to make comments, we will do that during the public comments portion. Okay, so what I would like to tell the committee is that our outreach efforts over the past year and a half really appear to be paying off. We've seen a large number of applications from all across the Commonwealth of Virginia. And this includes for individual awards, cooperative partnership awards, as well as our gold standard applications. We've been very pleased with the quality of the applications that we're seeing across the board, and very few instances where we've seen requests that are not allowable. And so, you know, at the very beginning, we were concerned that we would see requests for grants for things that are not allowed under the settlement terms, and that has not been the case. And in fact, we're seeing a lot of different strategies that cities and counties and organizations at the local level have been coming up with and bringing forward. And it's not all focusing on just one part of the recovery ecosystem. It's prevention, it's education, it's harm reduction treatment, and a variety of recovery supports. And we're also seeing a number of localities demonstrating that they are willing to begin a project with their settlement funds, knowing full well that they will need to provide their own funding in the future to sustain those projects. And so this is, I think, a very important point. As all the members of the board and the grants committee know, you know, there's a beginning and an end to the opioid settlement funds, and we have a large amount of money, but in 15 to 18 years, there'll be no additional money coming in. But so we're already seeing a commitment from localities to plan today to pick up that tab in the future. And I think that's very important. I will say that there is a lot of competition and a lot of interest in the cooperative partnership grants, our competitive grants, and not seemingly as much interest by communities in applying for the funds that are set aside specifically for them. And there's probably a few reasons for that. And one is that they're not required to spend those funds yet. They have more time left to spend those funds. And I think maybe the regional effort probably is appealing for a number of reasons. But when we start talking about applications that we've not been able to recommend for approval, keep in mind that most of the communities around Virginia still have money sitting next to their name in the OAA's bank that they can apply for. It's not competitive, and they can receive those funds. Okay, so how does the staff make its recommendations to the board? The first step is that we budget the awards over a period of time. As I mentioned, the settlements span 18 years. There is no revenue in perpetuity. And so this is a chart that shows sort of the cash flow. The cash flow is the line, and then the expected expenditures over time. Last year, the board adopted an approach that they called the measured approach, which means that we're trying to spread out the allocation of funds so that we don't see significant ups and downs each year in order to provide some sustainability for the programs that these funds will support. And so when we come up with a budget for each and every year, it's based less on how much money we have available in that year and more on the overall term of these settlements of the 18 years and trying to plan it out so that we're not spending everything we have just because we have it, but rather to spread it out. So that's the first step in developing the budget. The second step is to follow what the Code of Virginia requires, equitable distribution. And the code requires that the OAA make awards from our fund in a manner that distributes the funds equitably among all the community service board regions across the Commonwealth, of which there are 5. And so in keeping with that, we've come up with a target or a budget for each of the 5 regions, and it's based on the measure of harm per capita that was attached to the statewide allocation agreement, of the settlement agreement that was signed by the Commonwealth and by all of our cities and counties. And as a result of that, you see the target for the current round of grants for fiscal year 2025 for how much we are budgeting to be able to award for each region. Now, this is a target. It's not a hard and fast number. Obviously, we can't award grants that we don't receive. And in some cases, we've received applications for grants that exceed the target. And so we try to balance all of that against these considerations. You will see that Region 3, which is the far southwest region of the Commonwealth, has the largest target this year at just over $4 million, but we also received nearly 17 million in requests just from that region. And then the third way that we prioritize projects, for example, within a region, is by using the other areas, the other requirements of code where we're required by statute to give priority to applications that accomplish the following. And there's 4 of these items listed. I've highlighted some of the key words. Programs that have an established record of success, programs in communities that have a high incidence of opioid use disorder or death relative to population, or this is what we call the harm per capita measure, economically disadvantaged communities, and a kicker here, the 4th one, is the localities that bring forward a monetary or cash match with higher priority given to the efforts that come with a larger matching amount. And so that's sort of from the large to the small, how we prioritize which projects are recommended for approval. With that as a general overview, the majority of the heavy lift today falls to our Director of Operations, Charlie Linekum. I'm going to stop sharing this screen so that he can begin sharing his. And with that, Madam Chair, I'll turn it over to Charlie Linekum.
Thank you, Tony, for your report. Charlie, we are excited to hear yours. We will turn it over to you.
Thank you, Madam Chair. Please indulge me for just a second. I have too many things open on my desktop here. So second, I should be ready. Apologies. Right place. Goodness. I promise this will go faster in just a second.
And Charlie, if it helps, I can do it from mine, and as you narrate, I can advance the slides.
All right. We see the slide deck now?
Yes.
Awesome. Thank you. Again, my apologies, Madam Chair, members of the committee. Too many technical difficulties hitting me today, all at the same time, right before we start, of course. So here, my update today is a review of the grant applications that we've received from cities and counties. So first, I want to note that our application period opened October 1st, 2023 and closed April 1st, 2024. Throughout that time period, we received 126 unique applications. If you remember back in December, we awarded an individual distribution and some individual planning grants you see listed here. And in February 23rd, we awarded some additional individual distribution grants. Also, throughout the time, we received 37 gold standard applications. That application process is now one-time opt-in. There's no additional action required by the grants committee to adopt this. And I will note that our state agency proposals are currently open. That period closes tomorrow at 11:59 p.m. Currently, as of noon today, we had received proposals from 9 agencies consisting of approximately 20 projects, and we know there are more to come. So some quick fast facts. Since the February 23rd meeting and April 1st, we received 109 of those 126 applications. You can see on the chart here, these are developed by type. I mean, these are displayed by type, the individual distribution for cities and counties, the cooperative partnerships, and the gold standards. As you can see, quite a large amount of cooperative partnerships that I believe is equal to the total number of applications we received in last year's cycle. By region, for this between February 23rd and April 1st, here you can see the different Department of Behavioral Health regions, which I'll show you in a minute or two for a visual standpoint. Region 3, which is far Southwest Virginia, and also where our outreach coordinator, Cindy Newman, works, is leading the pack this year, especially in the cooperative partnership area. And so comparing 23 versus 24, throughout 23, we received 47 total applications. And in 24, you can see the 126, and I have them broken out here by type. So we are making significant improvements as a state in getting funding requests together and for consideration and award. So I will now move into reviewing the individual distribution applications that are for amendments and renewals. So these are awards that were made last year or earlier this fiscal year that are requesting additional funding or carry forward funds from the current to move along into the next performance year. So amendments and renewals, we have Louisa Counties has their dedicated clinician carrying forward some money as well as bringing down some individual and gold standard for this year. Henrico County is continuing their office-based opioid treatment expansion project with individual and gold standard. Smith County is continuing their recovery court with a small bit of carry forward, as well as some additional funds from individual and gold standard this year. And then Arlington County is also continuing their office-based opioid treatment expansion project with carry forward, as well as some additional funds out of individual distribution. We also have Roanoke City, which had a number of projects last year, all of which they have funds. Some of the projects were a little slower in getting started than anticipated. They all have enough funds to carry them through FY25 as they currently project. You can see emergency medical services training and supplies, xylazine test strips, a warm line and marketing project, certified peer recovery specialists, and adverse childhood experiences projects all have carry forward, totaling $252,000, but no FY25 requests from Roanoke City. So now we'll look at new projects for individual distributions from cities and counties. First, we have Franklin County, the Grace House Pearl Program. This is to renovate a recovery home for pregnant and or new mothers in recovery needing temporary housing. This is a currently active operating home. The renovations will provide access to 2 additional units on a second floor that needs a staircase completely rebuilt on the outside, allow them to increase their capacity. A small ask, $11,505, but they are bringing $144,000 in direct distributions. So the individual and gold standard are just are taking care of the balance. Hampton City, a new project for substance use disorder screening and MOUD expansion in a jail-based setting. 125 an individual, 31,000 in gold standard. Henrico County, new project for a kinship navigator. So this is a family service specialist that will be within the local Department of Social Services to assist families in kinship and provide kinship, assist families that are in kinship care and connecting kinship caregivers to resources to promote permanent placement of children, creating more stable environments, reducing the risk of SUD development by children in foster care. So the kinship care helps keep them out of the general foster system. $80,000 in individual. And Sussex County is doing the Sussex Safety First campaign, which is going to focus on opioid awareness centered around prescription safety and lock boxes. Small amount there, $11,976 from individual and gold. Additional new individual projects. Bedford County is going to use some of their money to develop a strategic opioid abatement plan. Orange County is doing a resource and gap analysis for an existing council that they have called their Epidemic Intelligence Council to help with asset mapping and gap and needs assessments so that they can determine best strategies for their community. Both $45,000 individual distributions, and they are providing direct distribution matches along with those. Apologies, I have a repeat of the Henrico and the Sussex here. I think we have already covered them. And Rockingham County, new project for the Rockingham Harrisonburg Adult Treatment Court. It's going to provide a supplement to support treatment services not fully covered by insurance or Medicaid. You see Page County Adult Drug Treatment Court, same thing, subsidized cost of services not covered by insurance or Medicaid. And then the Winchester City, an addiction response officer to bridge gaps between law enforcement and individuals with SUD. We did confirm that the officer's responsibilities will be entirely related to SUD, primarily opioid use disorder. Case management follows up on treatment, connections to resources, harm reduction, treatment, and recovery. 96,000 total individual and gold standard. Newport News City is expanding their jail-based treatment program, hiring 2 additional substance use counselors, and providing an injectable MOUD to inmates upon their release. 11,796 total of that project. And then we have a couple of other counties with multiple projects. With Gloucester County, which has 3 projects totaling 72,076, prevention and treatment youth specialists for addressing needs in Gloucester High School, an MOUD dosage subsidization to subsidize the cost not fully covered by insurance or Medicaid, and then a subsidized transportation program. This is a pilot project to help people basically get a ride to OUD outpatient treatment facilities in their community. Roanoke County has 2 projects totaling $186,275. Partnership for community wellness, youth-focused in-classroom curriculum and confidence building, risky behavior prevention, and weekly parenting program for women, $146,275. And then family service of Roanoke Valley and a mental health support and SUD initiative. Provide mental health and mental wellness services to families who have been affected by substance use disorder, 40,000 individual. And then Richmond City believe is the last one of the individuals, has 3 projects: a youth prevention campaign, target audience of youth aged 13 to 24, providing sub grants for peer integration. So this would be, they would be able to make an award or awards to multiple organizations to integrate peer recovery specialists into things like emergency response, detox, recoveries, to enhance the continuum of care for individuals affected by opioid misuse. And then harm reduction vending machines, to purchase, deploy, and stock 3 vending machines in targeted locations in the city. They'll be working with the Richmond Henrico Health Department on that. So they're totaling, I apologize, the total for Richmond City is incorrect. As we can see, we're looking closer to $400,000 from them. All right, so now I'll move into cooperative partnership applications. So this is, because of the competitive nature, we have to kind of consider amendments, renewals, and new projects all together. So they are noted as we go through, but they're not all, they're not broken apart by that way. So as we talk about regions, because as Tony mentioned earlier, we have to kind of do this, try to look at an equitable distribution across. You have the light green is region 2 in Northern Virginia. The darker green is region 1. The orange is the region 3. The purple is region 4, and the yellow is region 5. So there's kind of a visual representation of the areas that we're talking about when we're trying to get the money distributed. Also note common contingencies that are applied to cooperative partnerships. They must complete an operational agreement before funds are transmitted. If they have carry forward, we're requesting they encumber 80% of their carry forward before we transmit their FY25 funds. Any capital projects must complete a capital cost agreement that would have them maintain the approved use for 15 years. And that is required also before the FY25 funds are transmitted. And all projects must provide completed MOUs and contracts between fiscal agent and subrecipients. So we'll start with Region 1. Stafford County, mobile Medicaid assisted therapy, and their Sunshine Lady House Detox. This is all through their community service board. They had a slow start. They're carrying everything from FY24 forward, and then they are keeping their matching funds that they had pledged in individual and gold standard, and just asking for a small balance for an unexpected increased cost in their mobile unit purchase. Beyond Vista City, the Hope House Men's Recovery Home has no carry forward. They had a ribbon cutting about a month and a half ago. I had the privilege to attend. They are open and working. So they had some slightly increased costs for cooperative due to some unexpected things they had to take care of, but it's all operations. And they're bringing in, all the localities are bringing in individual and gold standard amounts. Culpeper County renewing their Encompass peer support specialist, which embeds them in with EMS and hospitals for rapid response. They have a small amount of carry forward, and they also have additional funds they're requesting for this year. Lynchburg City, they're adding adult detox to their crisis receiving center. They are just asking to carry forward the balance of their FY24 award, which is about $1.6 million. No 25 funds are requested as they're still in the renovation process. There will be a small operational request probably in 26 once they are open and operating. Region 1 continued. Albemarle County has 2 projects, renew and amendment, total of $1.7 million. They have a crisis intervention team assessment center expansion. That's about $1.1 million in cooperative funds, and then a community drop-in, which is $610,000 or so. Rockingham County also has multiple projects, but I have a special note about one of them. So I'll skip down to the lower bullet. In FY24, we awarded 2 separate projects to Rockingham, along with who's working as the fiscal agent with Harrisonburg. They are for a crisis intervention team assessment center and a crisis receiving unit. After working on this renewal and amendment with the fiscal agent, we kind of determined that it made more sense for both the OAA and Rockingham to combine these into one, as the projects have things that overlap and they're in the same location. So we're recommending that we combine these projects. They have a carry forward combined between the two of 143,000, and that they are requesting an additional 204 in cooperative funding for operational this year, and along with some individual match. On more Region 1 continued, Harrisonburg City has a new project, and they are working as the fiscal agent for this project with Rockingham as a partner. This is a peer recovery center staffed by Strengthen Peers. It's an alternative recovery program for individuals who face barriers to accessing traditional treatment. Frederick County has a Northwest Regional Jail MOUD project, also a new project. In their Northwest Regional Adult Detention Center, 235,000 cooperative request. Charlottesville City is expanding their special docket services regionally in the 16th Judicial Circuit. And you can see the various additional courts that will be provided that service, 383,000 cooperative, $5,000 individual match. And then Allegheny County has a project, a one-stop continuum of care. This is a facility renovation to connect all their services in one place. You can see things like group and individual therapy, pharmacy, case management, IOP, telehealth, psychiatry, etc. They're only requesting capital funds to get the project up and going. So because of that and of the kind of more one-time nature, while they have provided some individual gold standard match, we're recommending the just over $1 million award to come from the unrestricted funds that are available to the board. Region 2, Fairfax County. This is a renewal and amendment of their adolescent substance use disorder residential detox and treatment and crisis services. So they have had a very slow start, unfortunately, with trying to get responses to RFPs, and been working on various plans. And they have actually reissued their RFP. And seem to have a better path forward now. And so they are carrying forward everything, including matching funds from 24. And then they are asking for some additional 1.8 million in cooperative. Part of that is because they had determined they needed to add crisis stabilization to the request to make it a better continuum of care. And there's some higher than estimated costs that they are expecting related to facility renovation. As a contingency on this, in addition to the other ones, they'll submit the results of the revised RFP to us along with their plan of action for FY25 before we transmit funds. Prince William County has their Greater Prince William preferred office-based opioid treatment. They have 365,000 to carry forward, and asking another 549,000 for this year to balance out their operational needs. All right, Region 3, this is the big one. Wise County, multiple projects, total recommendation of 456,000. Adolescent intensive outpatient treatment program. This is a renewal. They are carrying forward 118, and we recommend 224, and they're bringing in some individual match as well. They also have a new project, Gate City Recovery House. This is in the Planning District 1 area. It's a men's recovery house. It'll be based in Scott County. FY25 recommendation, a total of 162,000. Russell County also has multiple projects. These are all new projects. Recovery residences in Russell and Dickinson County, a women's facility and a men's facility, a total of 18 beds added to the community. A $250,000 request. Recommendation, a 90-day community residential program. This is a stepping stone from individuals released from DOC, Department of Corrections, and helps them reintegrate into the community. So this is a one-time ask, and we are recommending only funding the capital costs in their request and out of the unrestricted because they are capital in one time. And then there is the Southwest Virginia Alcohol Safety Action Program enhancement. The request for this was to enhance their existing program by implementing an expansion of services targeting opioid use offenders, in addition to the alcohol and other programs that are part of that. We did not make a recommendation of funding for this project due to budget constraints in the awards, as you heard Tony talk about earlier. Continuing to Region 3, Montgomery County, New River Valley Ecosystem renewal. An amendment carrying forward funds, both cooperative as well as matching funds. In FY25, we're recommending 2.2 million in cooperative, as well as their pledged individual and gold standard matching funds, total of almost 3 million. There wasn't a request and an amendment for an additional 978,000 in new portions of the project that were not recommended due to OAA budget constraints. With County, the With Bland Multidimensional Family Resource Services Project, evidence-based parenting service for families struggling with SUD. This was another one we unfortunately were not able to recommend due to OAA budget constraints. Grayson County, this is a recovery port enhancement. This is a renewal and amendment. They're carrying forward 153,000 and requesting 82,000 balance to fund the program for the next year. Smith County, multiple projects. We're renewal and amendment of expanding their OBAT and their regional recovery housing, carried forward 60,000 and requested a 939,990 for the balance of the operations for the year. New project, Appalachian Center for Hope Treatment Facility. Treatment and recovery housing was determined to be the two most needed resources in that region. And in 2021, the Virginia General Assembly donated a building for this purpose in the community. This is a one-time ask of capital costs, 1.5 million that we're also again recommending from the unrestricted funds. Project Pathfinder, another new project, partner with Southwest Virginia Legal Aid Society, provide primary and dedicated civil and legal assistance to people in recovery. Recommend 305,000 on this. There is an additional contingency on this that we get a detailed report yearly about the types of barriers that this project has been able to remove. The project understands that they cannot represent these people with our funds against any other agencies of the Commonwealth. And additionally, they'll have a listing if there's any expungement of records that are related to this. We'll have a listing as to what those types of records are. That will give us the ability to monitor this and ensure that we're all staying on the track of it. We intend to. And then another new project, which is the Mount Rogers Area Mobile Services. This is 8 partnering cities and counties, which I believe is our largest cooperative project, at least as far as makeup of localities. They're going to get 2 mobile care vehicles to provide, as you can see, a number of various services to the community. And it's 2 community service boards along with the Mount Rogers Health District that are all working together. So very, very large partnership, 1.1 million cooperative funds recommended for that. Roanoke City, multiple projects. There's the Roanoke Valley Collective Response Program that was funded last year. They have opted that they do not need any funds for FY25. They're just carrying forward a large portion of last year's operations. To keep things moving, new project for restoration housing for women and infants. Facility that will serve pregnant and postpartum women with SUD and their infants. One-time capital cost request, 225,000 cooperative. There's also a pilot drug checking program through the Virginia Harm Reduction Coalition, another new project utilizing harm reduction and evidence-informed methods around illicit substances in the Valley. Unfortunately, we're not able to recommend this one due in part to budget constraints, as well as some concerns regarding the testing of the illegal substances and methods to access those substances. And then finally, there's the Navigator Care Specialist new project, which was working with parents and legal guardians with OUD who are involved with Child Protective Services through Department of Social Services. This is another one we were not able to recommend because of budget constraints. Continuing on, I believe, yes, this is the last slide for Region 3. Danville City, the bridge, which is a kind of expansion of opioid use disorder services for the Community Service Board. You can see the various list of items there. This is another one that unfortunately we're not able to recommend due to budget constraints. Henry, I should say, all of these on this page are large projects that we were not able to recommend due to budget constraints, including Henry County's Lighthouse project run by the Piedmont Community Service Board, which was expansion of the Crisis Intervention Team Assessment Center to really be able to provide a full continuum of crisis services. Then the Washington County YWCA Community Wellness Project, triple available space to serve community and address SUD epidemic. Again, this was not able to be recommended because of budget constraints. And then Dickinson County Wildwood Health and Wellness Center was one to provide services to raise awareness, education, prevention, address root cause of opioid use, and streamline medical care, mental health services, etc. Another one we're not able to recommend due to budget constraints. Region 4, Henrico County, Pregnant and Parenting Women Program. This is a renewal. They have some carry forward funding as they're kind of just getting started, and then requested just the balance to keep everything moving. Hanover County, Project Recover. You have a decent bit of carry forward, and again, it brought in some matching funds and provided asking the cooperative funds to keep everything moving forward. Chesterfield, mobile outreach and harm reduction program, renewal and amendment, carry forward of 1.4 million. They've had a slow time getting going. Again, just ask for some funds to take care of the balance of operations for 25. And then Richmond City, this is a new project for resource mapping of SUD-related resources. They're going to refine an existing map that a different grant paid for, develop a process to curate the data and market the information to the general public, bringing in 10,000 in individual and 173 in cooperative requests. And I apologize, as I was to pull the wool away, I was having trouble with my Region 5 slide. And so I will use the our summary recommendations that are posted on our website and have been provided to the grants committee members for the visual to finish these off. So this is for, apologies, Virginia Beach City. This is a regional mobile van for primary care. I want to like to note that this project is a result of a cooperative planning grant Virginia Beach applied for and received last year. This is our first planning grant that's come to fruition and has turned into an application. It's going to be a partnership with Centera Healthcare to basically, propose a mobile outreach program with primary care and MOUD, behavioral health assessments, peer recovery services, harm reduction, and linkages to long-term care. Recommended $833,785 in cooperative funds, and Centera is also bringing in some match that's not reflected here. Oh, I do apologize. I missed one from. Oh no, this is also in Region 5. I apologize again. So this is a project led by Prince George along with Surrey County for a crisis receiving center I believe in the Prince George area. Kind of outfit, renovate a facility to be able to provide crisis receiving services. There was a small individual distribution from both localities, along with the with the 1.2 million that was requested. This is one, unfortunately, we were not able to recommend funding due to budget constraints. Newport News, working with Hampton. This is a project for peer recovery in, excuse me, as well as a drop-in center. And CSB is working with them. They're narrowing down their options. This is both localities, as you can see, are bringing in matching funds, and there's a 322,000 cooperative. This project is recommended to be funded at that. Another project with Newport News and Hampton is a mobile medication and outreach unit. Again, working with the Hampton Newport News CSB. And they have also received a grant that has been from DBHDS to help purchase the vehicle. and has letters of support from within the community. They're bringing forth matching funds from their individual and gold as well. 356,000 total request. James City County. This is a historic triangle drug prevention, marketing, and public education campaign. They are requesting, they're bringing in match in both individual and gold, a small amount. There's a $48,000 request there that we're recommending. Another one from James City County, working with Williamsburg. This is an alternative docket for Williamsburg, James City, and York Pocosin circuits. We are recommending they requested individual distribution gold standard as well as cooperative funds. However, this project is not quite far enough along that the full approval of the dockets have been provided by the Supreme Court. So we are recommending approval of the individual and gold standard to help them keep moving in the process where they are. And then sorry, just realized that I am not showing you what we're looking at here. Can you all see the summaries here now? Apologize. Thought I had them on the right screen. So we're once they are able to get the approval from the Supreme Court, they may come back and look for another cooperative request, a cooperative fund request. But at this point, we're recommending approval of the individual and the gold to keep them moving along. And then we have Chesapeake. This Chesapeake working with Virginia Beach. This is a renewal. They are just asking to carry forward their amount. This was for capital, for them to build a 20-patient in-bed psychiatric unit. They're still working through the process. They have actually, the cost of the project has increased, but they've also been able to find additional funding. So they're working on moving forward on that project, and are just requesting to carry forward. This was a one-time award from the cooperative partnership funds last year. And then Gloucester County Regional Jail Medication Therapy for the Northern Neck Regional Jail. This is a request of $215,485 that is recommended for approval. And that would conclude my presentation and the summaries. Apologize for the technical back and forth there.
Thank you, Mr. Linicone. That was a great presentation, and I'm sure the rest of the Grants Committee will agree with me that how impressed I am with the breadth and depth of the projects. And I'm really happy to see all the recovery support, treatment, medications for opioid use disorder, and great expansion in our corrections facilities, and so many prevention and harm reduction projects across the Commonwealth. So just great to see all the applications and the funding that will be coming their way. So now it's time for our public comment part of our agenda. And this is where anyone from the public can address the committee. We do ask that you keep your comments to no longer than 3 minutes. To indicate that you would like to speak, I'm going to ask you to click the raise the hand button on your screen. And Kara, it will be our staff moderator, and she will call your name and allow you to speak. She'll unmute you, and we'll do that one at a time. So at this time, I'm asking anyone who'd like to speak, go ahead and click the raise the hand button, please. Okay, Kara is saying we do not have any hands raised. So last chance, please, if you have anything you'd like to say, take this opportunity because we would like to hear you. All right,
Madam
no
Chair, I think
questions and
Charlie
answers.
did such a good job. There are no questions.
Looks like we do have one hand just raised.
Sorry.
Okay, Holly.
Yeah,
Oh,
sorry to be a
sorry.
little slow. Getting my hand up. I don't know. This is Holly Lesko. I'm with the New River Valley Regional Commission, and I just wanted to say thank you. We've worked really closely with the staff in doing this year's proposal and feel like it's really been important to us to understand the process and to be able to share that back with our localities. And we're just grateful to have this opportunity and look forward to moving this work forward this year.
Great, thank you. Our staff are amazing, aren't they?
Indeed.
Thank you for your comment. Okay, I'm going to recognize Steve Wright, who would like to speak.
Yes, thank you, and good afternoon to the committee and to the staff of the OAA. I'm one of the two deputy county administrators for Gloucester County, and I just wanted to comment and say that from the beginning of this initiative, Tony and Charlie and their staff have been absolutely exemplary to work with. They are incredibly collaborative. They answer questions quickly. For those of us in the state, and it's many of us who, are not addiction services providers, we in Gloucester County had no idea how we should utilize these funds when they first came to us. But they have been an incredible resource, just incredibly affable and helpful and collaborative. So I can't possibly say enough about Tony and Charlie and their staff and the exemplary work that they're doing. So thank you for that.
Totally agree. There's a reason why the rest of the country is watching Virginia, and it's because of the names and the rest of our staff that are working with the Opioid Abatement Authority. So thank you for those accolades for them. They're very well deserved. Do I have anyone else who'd like to speak? Okay, Dan Gelman will be next.
Hey, good afternoon, and I want to recognize the efforts of this committee in reviewing 45 minutes worth of slides and all the various projects that were presented to you and having to make a lot of difficult decisions. I wanted to take an opportunity to talk about one submission in particular that we put forth, and unfortunately it wasn't approved, but I wanted to just take a minute and explain why we think it's incredibly important that we potentially reconsider. So Pyramid Healthcare is a treatment organization. We've been providing multiple levels of inpatient treatment and outpatient treatment for over 25 years. And that's the core thing that we do. We do treatment. Occasionally, in the course of those 25 years, we've found that we have a difficult time with aftercare planning because of the fact that we treat a large percentage of homeless individuals. And this is what we found in Virginia, in our program in particular, in the New River Valley. We have a very difficult time placing individuals who are homeless or indigent and getting them into housing. And for that reason, we proposed 2 recovery houses in the New River Valley region. And we were part of that Montgomery County project that was proposed. And just to advocate for the housing, not only is it a concern for us because of our own aftercare planning, just in general, when we look at the social determinants of the social determinants of health and the reasons for ongoing relapse and overdose and death, a lot of that is because of not having access to safe, sober housing, not having access to employment, and not having access to food. And our proposal was going to be able to address those things for a relatively low monetary ask. One thing we didn't include in our proposal was that we were going to be, I know there's the component about the match from the provider or the whoever's making the proposal, and we were going to be purchasing the 2 houses for approximately $500,000, and our ask for this year was $144,000. So I guess I would just ask the committee to reconsider if possible, since it's a relatively small amount and can really save many lives over the course of the year. So I'll step down, and I thank you again for your time and for listening to me.
Thank you so much for your comments. We'll take under consideration. All right, anybody else have a comment they'd like to make? All right, I appreciate everyone that made the comments. We're going to move on now to our new business part of our agenda, where we will go ahead and consider all of the amendments, renewals, and new applications that Mr. Linticum just took us through. So could you go on to the next slide? We're going to do consideration of these grants in two different blocks. So this is attachment A, was included with the agenda. These are the recommended awards to cities and counties where we did not have any member of the grants committee that has requested to abstain because of a possible conflict of interest. The next block B will have conflicts of interest. At this time, I will entertain a motion to approve Block A of awards that were listed on attachment A to the agenda, consistent with our staff recommendations. And I just heard a motion from Senator Pillion. Who was the second?
A second from Jim Holland.
Okay, I have a motion and a second for approval of these grants. All in favor, please say aye.
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 Any against, please say no, nay. Okay. Any abstentions? Okay. We have approved those. Let's go ahead and look at Block B. These are awards that someone on our grants committee, one or more members, had a request to abstain due to possible conflicts of interest. And now I will entertain a motion to approve Block B awards, and I will ask for abstentions just like I did. So if you have to abstain, please do so. So do I have a motion for approving? Thank you, Senator Pillion. Do I have a second?
A second, Mike Tillum.
Thank you, Mike. Okay, all of those in favor of approval of the recommended grant awards to cities and counties, please say aye.
Aye.
Aye. Any that oppose, please say nay. And at this time, I'll ask for abstentions.
This is Tim Spencer from the City of Roanoke. I hereby abstain and refrain from participating in these matters in accordance with Virginia Code 2.2-3112. And the fact, because I am an employee of the City of Roanoke and I have a potential personal interest in these items. Thank you.
Secondarily,
Thank you, Mr. Spencer.
Secondarily, Jim Holland abstained from all Chesterfield related, as I am a supervisor in the county of Chesterfield.
Thank you, Mr. Holland. Any other abstentions?
Sharon Buckman, I abstained from any matters related to Franklin County because my employer would be a recipient of that funding.
Thank you. Ms. Buckman, any other abstentions? Okay, so those have been approved, noting the abstentions from our committee members that had conflicts of interest. At this time, we'll move on to see if we have any consideration of other items of new business.
Sarah, yeah, hey, this is Senator Pillion. I'd just like to echo the thoughts of everyone on this call. You know, obviously our staff is making our job as board members a very easy one. And they're making us all look really, really good. But in turn, they're also making a tremendous difference throughout the Commonwealth. And I think that almost every locality now in the Commonwealth has received or been engaged with the OAA. And that's what we wanted from the beginning. We didn't want this money sitting in an account, not working. and I couldn't be more proud of them. I would be remiss if I didn't give a special shout out to Cindy Newman, who has obviously done a terrific job in Region 3. And I know that we're planning on doing some other people like Cindy throughout the rest of the Commonwealth, so we can continue the success stories that she's created in making sure these grants are getting funded in Region 3 and the rest of the regions of the Commonwealth. With that being said, I am very involved and have a lot of knowledge about a particular application that was considered, but due to financial restraints was not awarded. I have, if any of you all, and I hope you have read Dope Sick, have read Demon Copperhead, then you would have the passion about the Wildwood Health and Recovery Center that I do, because that center is one that's going to take care of the people that were described from Lee County and Dickinson County and Scott County. And I would like to make the motion that we would consider funding this worthy cause. I know their timeline. I know it's very, very important to them that they can move forward with this. They have a tremendous need. They have a tremendous program that it's in place. And this is the piece that they have to make it all come together. So I'm making that motion that we would consider awarding this grant for the Wildwood Health and Recovery Center, in addition to the other grants that we've awarded.
This is Delegate Brianna Sewell. I second that motion.
Okay, thank you. We have a motion and a second to consider funding the Wildwood Center. I'd like to hear from the other grants committee members, any comments and discussions, concerns, anything from staff that they would like to share.
Madam Chair,
Questions?
if it's acceptable with the committee, perhaps Cindy Newman could give us a quick overview of that project, as well as the exact amount of money. So that
yeah, thank you, Tonya. I wanted to know the amount.
Yes,
This
Cindy,
is
that would
Jim
be
Holland.
great.
This is Jim Holland. Let us know
Yes.
details. Yeah.
Okay, I have some details for you. Okay, the grand total for FY25 would be $1,709,675, and that would be with an anticipated renewal for 26. As Senator Pillion stated, so I probably might just be reiterating, it would be a facility that would, sorry, I'm trying to look at my notes here, that would raise awareness for education, prevention, the root cause of opioid misuse, streamline access to care for medical, mental health, medications, SUD and recovery. And for anybody that's traveled over in that area, just the barriers to access to these programs is really significant. So I think that would be something, to consider as well with this one. We couldn't obviously recommend it because of OAA budgetary constraints, but I appreciate Senator Pillion bringing it to the attention of the board and asking you all for your thoughts on this. They would also include childcare, I'm reading along here, anti-stigma campaigns, education, comprehensive training for first responders and the community. And I would like to add in, just as an aside, they are doing the ARC, the addiction recovery care facilities for men and women. Their community alone, through COLE grants and some loans, have put in over $5.5 million into those programs outside of asking for any OAA funding. So I feel like they've made just a huge commitment in that area toward bringing these services to a very underserved and rural population.
Sounds like this funding is really needed for them to be able to continue what they want to offer. Is that right, Cindy?
It is. They have the, if you're familiar with Dickinson and Wise County border there, and Red Onion State Prison's there, if you're familiar with the area at all. This ARC, the Wildwood treatment center for men is right there. The county has gifted a building for a facility that will be for women there. Can't call the name right off, but it's another Ralph Stanley go to there because it's a very rural area there with a lot of heritage there with Ralph Stanley. But there's going to be a women's facility, and they've put all in as well with some county dollars, donating buildings. So they've really gone on in. This center would provide them sort of like a resource center where they can all come together, provide services for folks coming in and out of that treatment, which by the way is statewide. That'll be revenue based. And so anybody in the state can go to those two facilities. So it won't just be specific to that region. This center would open up a lot of opportunities for those folks to go in for parenting, opioid misuse, just a lot of resources that if you've not been over there, just really inaccessible to folks who live in that region. To get out to another area that would offer those is the barriers are they're really almost insurmountable for lots of folks, and especially if you do not have transportation. And even with transportation, it can be very difficult. And I really feel like they're just trying to really dig in and provide these very comprehensive services and just get a little bit of a bite and out ahead of this opioid crisis. It's been really hard hit, I know, in a lot of areas. But if you look at harm per capita and economically disadvantaged, that region's been hit really, really hard.
Well, yes, they certainly have. Thoughts from the staff that if we would like to proceed with funding, would we use unrestricted funding? What would you recommend?
Thanks for that question, Madam Chair.
I think I can answer that for you. What I would like to suggest is that if one of the members of the grants committee was willing to offer a friendly amendment, if the senator was amenable to it, that the amendment could be revised to say that the committee award a fiscal year 2025 cooperative partnership grant to Dickinson County, acting as the fiscal agent along with Lee and Scott counties in the amount of $1,709,675 to fund the Wildwood Health and Recovery Center as proposed in the application. This funding shall be contingent upon the applicants completing an operational agreement and adhering to all the OAA terms and conditions. I think that would
This is
wrap it
Tim
up in terms of the
Spencer.
details.
I offer that friendly amendment.
Okay, so we have a motion on the floor with an amendment. We had a second. Do we need a second for the amendment?
Mike Tillum, my second.
Okay.
I think it's a great cause. Let's do this.
Okay, any other discussion before we proceed with the vote? Any other concerns, discussion we want to have?
Yes, this is Sharon Buckman. I would just like to express the concern that clearly this is a very worthwhile program. However, I think that it's been recommended to deny others who perhaps don't have the same representation from comments and that kind of thing. And I would like to hear more from the staff about the budgetary constraints that cause them to recommend denial.
Charlie, Tony, could you address that?
Absolutely. So you may recall that as we were going through the presentation earlier, I wanted to explain to the committee how we make our recommendations. And so first of all, we're looking at the length of time that we have these settlement funds, which is a total of 18 years. And so we have the cash. That's not an issue. The question is, how do we space it out over time so that when we provide funds to a recipient, that we can continue to provide those funds for potentially up to 5 years, so that they can continue to build their program and continue to operate the program before they need to find a different funding source. And so when we're balancing the budget, we're not just doing it for the current year, we're doing it for the next several years as well. In this particular case, there's only 2 years requested on this grant. And so that really counts in their favor because we would not be required to pay for it for 5 years, but rather just for 2. The second element we look at is the geographical distribution. And quite honestly, this project, if it was in a different area of the state, probably would be recommended for approval because it's such a well-documented need and a well-designed project. But because it's in DBHDS Region 3, where we received almost $17 million in funding requests, we simply had no choice but to begin to look for areas where we could make cuts. And then the third reason has to do with the how we're required by statute to compare projects to each other and how we prioritize them. This project, and Cindy can correct me if I'm wrong, which I may very well be. She's the one that was working most directly with it. Because the communities that are applying for this have sort of already tapped out all their money, they couldn't provide more of a financial match than they did. And not providing a match lowers your score, if you will. And so those would be the reasons why that this project was not recommended for approval. So again, I've told a couple of grants committee members that we, as a staff, our job is to bring you a balanced budget based on what the code requires of us and what the board has requested, knowing full well that it's the authority and the discretion of the board to make the final decisions. And so we've kind of put the hard onus here on you. If the committee chooses to move forward with funding this project, then we will rebalance in order to continue to meet those objectives going forward.
Thank you for the explanation.
Thank you for that explanation. Madam Chair, this is Treasurer Jim Holland. I'm inclined to support this request, and I appreciate the questions and concerns. Thank you. I will support this request.
So we have a motion on the floor. We have a second. I'm ready to call the question unless you guys have any other concerns you want to discuss.
Cindy, I'm sorry, Madam Chair, is this an amended motion or is this the original motion that was made and seconded?
The amended.
What was the amendment?
Tony, I'll let you say it again.
If I can read it to you and we'll capture it in the minutes if this is agreeable. Move to award a fiscal year 2025 cooperative partnership grant to Dickinson County, acting as the fiscal agent along with Lee and Scott counties, in the amount of $1,709,675 to fund the Wildwood Health and Recovery Center as proposed in the application. This funding shall be contingent upon the applicants completing an operational agreement and adhering to all of the OAA terms and conditions.
So it sounds like
that was offered as a friendly amendment.
That's what I was thinking. I'm sorry. Yeah, thank you, Tim. That's what it was a clarifying friendly amendment. I'm fully supportive and thank you for making that.
Yeah, I think that added the good clarification we needed. All right, if there's no other discussion, let's see.
Let me just add this, and I know I shouldn't speak when the train is leaving the station, but I know we're already here, but I do believe that we need more Cindy's throughout the Commonwealth, because this is obviously working. What she's doing is working, and I want to make sure that every region is benefiting like Region 3 has.
And you know what I like about the proposal as Cindy discussed it, this can benefit the whole rest of the Commonwealth because those services could be offered to those from other areas as well, like she discussed. So I think that's important to recognize as well. All right, so let's go ahead and take our votes. Tim, did you have anything you wanted to say?
No, just getting ready
I saw you go off mute. All right, you're ready to go. All of those in favor of funding the Wildwood Center per the amended motion that we just heard from Mr. McDowell, please say aye.
Aye.
Aye. Those opposed, nay. Any abstentions? Okay, we have voted to approve that project unanimously. Any other items of new business at this time?
You need a motion to adjourn?
Well, I was just given a minute there to see if anybody else. Tony, I just wanted to address the when Dan Gelman discussed his project. They have the opportunity to reapply and make any adjustments as needed with your guidance. Is that correct?
Yes, ma'am, that's absolutely correct. And this, what I'm going to tell you, is true for all of the projects that we had to recommend for denial, which is that we will continue to work with those applicants. And sometimes there's more than one way to accomplish what they're trying to do. As I mentioned during my report, not all the funds need to come from the cooperative partnership area. There are also individual and direct funds. And so we can work with them to find a way to get there. And in fact, some of those can move more quickly than others, and we will absolutely endeavor to do exactly that.
For example,
Chair,
Madam Chair,
Madam Chair,
on
this is
the Navigator program, we'll be using some of the funds we currently have to fund that project.
Madam Chair, this is Jim Holland. I do want to acknowledge, I just read someone in NUM, so I appreciate Tony's comment about working with other denied projects. As an anonymous attendee says, is this fair to the other denied projects? And so I think that is something that hopefully Tony can take into account in evaluating those. So I just want to respond to that particular question. And so Carol would like to answer this question live. Thank you, Carol Mazan. Thank you much. And I yield, Madam Chair, Jim Holland, I yield at this time.
Okay. Any other matters for us to discuss? Any concerns before I ask for a motion to adjourn?
Madam Chair, if I can, again, would like to welcome Delegate Sewell. This will be her first meeting. She was just appointed to the board, and appreciate her joining the Grants Committee and being part of this meeting.
Yes, I'll echo that too. We're glad to have you with us, and it was an exciting meeting for you to be here for our next distribution of funding. So making a big difference in the Commonwealth. All right. Would anybody like to offer a motion for adjournment?
I move for adjournment, Jim Holland.
Thank you, Mr. Holland. Do I have a second?
Second.
Thanks, Mr. Spencer. All in favor of adjournment, please say aye.
A little slow, Mr. Spencer.
Aye.
Okay, let's go.
Aye.
Thank you.
Any opposed to adjourning?
Take care.
Okay. No
Bye then.
opposition. Thank you guys very much. Thanks to the staff for your excellent work, and thanks to everyone that attended the meeting. We are excited to see everything that's going to be done in the next year with this grant funding. Everybody have a great evening.
You too.
Thank you. Bye.
Goodbye.
Bye, everybody.